Good morning, ladies and gentlemen. I'd like to present our study, Laparoscopically assisted anorectoplasty for the intermediate type of imperforate anus. Laparoscopically assisted anorectoplasty, LAP, for the intermediate type of imperforate anus is thought to be controversial because manipulation in the deep and small pelvic cavity is technically demanding, and there is a concern for visceral fistula. In addition, evidence for superiority of fecal continence after LAP is still lacking. So the aim of this study was to compare postoperative complications and fecal continence of patients with the intermediate type of imperforate anus who underwent LAP or SACROPERINEAL anorectoplasty. This study included patients with the intermediate type of imperforate anus who underwent anorectoplasty at our hospital between 1983 and 2017. Medical records were retrospectively reviewed and data were collected as shown here. Postoperative complications included mucosal prolapse, failed rectoacutaneous anastomosis, anal stenosis, and residual visceral fistula. Fecal continence was evaluated at 3, 5, and 7 years after surgery. As for fecal continence, the clinical assessment score developed by the Japanese study group of anorectal anomalies was used. It is a total score from 1 to 8, with 1 being bad and 8 being perfect. It is the sum of the urge to defecate and either constipation or incontinence, whichever is lower, plus swelling. Patients with intellectual disabilities were excluded from this assessment. As a result, 12 patients underwent LAP and 14 patients underwent SACROPERINEAL anorectoplasty. Patients' characteristics were similar between the two groups. Operative time was longer in the L group, and more bleeding was observed in the S group. This graph shows the total score of fecal continence. There was no significant difference between the two groups at any point. Regarding complications, mucosal prolapse found half of the patient in the L group and around 30% of the patient in the S group. There was no significant difference. Examination of residual visceral fistula was not performed in all cases, especially in the S group. Half of the patients in the L group showed visceral fistula, but after introducing intraoperative measurement of the residual fistula in 2008, incidence improved from around 70% to 0. In conclusion, fecal continence and the incidence of complications following LAP were comparable with those after SACROPERINEAL anorectoplasty in patients with the intermediate type of imperforate anus. Mucosal prolapse tend to occur more often in patients following LAP. LAP has a potential risk of residual visceral fistula, but it can be overcome by technical refinement using intraoperative measurement of the visceral fistula. Thank you for your attention.